Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Monday, July 20th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Brad, thank you and good afternoon. Today, the province announced that Toronto, along with Peel Region and Windsor-Essex, will continue to stay in Stage 2. This isn't surprising given the fact that we moved into Stage 2 later than other parts of the province, and public health officials are very cautious about the larger reopening. Throughout this pandemic, we have followed the advice of our public health professionals at the local, provincial, and national levels, and that must continue so as to make absolutely sure that we have a strong and safe restart and recovery. In that context, I support the decision of Premier Ford and the Government of Ontario, and will redouble our efforts here at the City to put us in a position to move to Stage 3 as soon as possible. Today's news, I know, will be frustrating for some who would hope that we could have moved forward, but we must not risk public health. People have sacrificed so much to get to the stage that we're at, and we don't want to go backwards and move back further into the direction of a lockdown. It will be worse for struggling businesses if we have to go back to a more widespread shutdown, much as we want to open up safely now and as soon as we can. A number of city facilities and amenities will reopen in Stage 3, including the city's more than 800 playgrounds and play structures, community and recreation centres, and libraries for all on-site services. City staff are now preparing for these additional openings so that we can move quickly when we do move into Stage 3. For example, they started inspecting and readying playgrounds and play structures last week, and that work will continue. One major aspect of Stage 3 is the reopening of restaurants and bars for indoor service. I know many people, including the Ontario Medical Associations, have concerns about this change. So do I, and that is because we have seen this leads to spikes in cases in other jurisdictions, and we do not want to see that happen here. We are continuing to have conversations with the province about the city's request for additional measures in bars in particular to protect public health as part of a Stage 3 reopening in Toronto. I asked public health officials to provide their best advice when it comes to bars and restaurants and indoor dining to ensure that the provincial regulations guiding Stage 3 do everything possible to protect the health and safety of Toronto residents and employees of the reopening businesses. Toronto Public Health worked with City Legal and Municipal Licensing and Standards to provide these possible changes, and as has entirely been the case throughout the pandemic, my letter to Premier Ford was based entirely on their advice. It is our hope that many, if not all, of these 6 recommendations could be quickly implemented ahead of any Stage 3 opening in the City of Toronto as part of the ongoing excellent cooperation between the two governments during the COVID-19 pandemic. I know Premier Ford is just as concerned as I am about a second wave and the disastrous impact that a return to a more stringent lockdown would have on the health of our residents and the restart of the Ontario economy. We have seen in other jurisdictions that further reopening can lead to increased outbreaks of COVID-19 and growing case count numbers. We absolutely, positively do not want to go in that direction. I firmly believe that for the good of the province and the city, we must continue to move forward safely, but we must also do everything we can to continue to stop the spread of COVID-19. So the changes that I have conveyed for consideration by his government with respect to indoor service in bars especially and in restaurants are fairly simple. 1. Requiring customers of indoor food and drink establishments to be seated at all times unless walking in or out, going to the washroom or paying the bill. The present requirement applies only while people are actually eating or drinking. Only then would they have to be seated. 2. Requiring restaurant and bar operators to keep a customer log with a name and contact information, along with the date, check-in and check-out times, and the table number, and keep that information for 30 days. Right now, this is only a Toronto Public Health recommendation, not a provincial requirement. 3. Implementing additional capacity restrictions for food and drink establishments that limit occupancy to ensure that physical distancing can be easily maintained by all patrons. Right now, there is no cap, provided that distancing can be maintained. 4, implementing early closure times for food and drink establishments for at least an initial period of time, similar to what has been done in Quebec. In this case, we have suggested midnight, as in Quebec. 5, requiring establishments to implement COVID-19 screening protocols for staff, such as completion of a screening questionnaire prior to the commencement of their shifts. And 6, outlining clear, mandatory face covering requirements for staff and patrons of bars and restaurants in the amended Stage 3 order. According to our health officials, these establishments present a higher level of risk of transmission of the COVID-19 virus. I support the province introducing these measures as part of moving the Toronto City to Stage 3. With today's decision, we have time to make these changes and to communicate them to bars and restaurants. I believe they will ensure that the progress we have made by following public health advice consistently will continue. And I also believe that businesses will follow these measures because they will understand that measures like this will protect their customers and employees and help prevent a spike in COVID-19 cases that could ultimately lead to a return to a more restrictive series of measures, including a return possibly to the closure of these very same businesses as we've seen in other cities. We are making progress in a number of areas. Parks Play TO is up and running, offering free drop-in and activity-based recreation programs to children at multiple locations across the city, free of charge. And Summer in the Six also began today. It offers slightly older young people, aged 13 and up, opportunities to drop in and to meet up with friends and to participate in the fun-themed activities. I was in the ward of Councillor Francis Nunziata today to see these programs in action on their first day. And there seemed to be a number of young people having a very good time, and I want to in particular extend my personal thanks to our park staff for working to provide programming for our young people this summer. You know, we've gone from a situation where there were plenty of programs planned, and in fact registration had been conducted, same with summer camps, to having to wipe all of that away in light of the public health requirements, and the staff in a very short period of time came up with and implemented summer camp and recreational programs that thousands of young people will be able to take part in across the city, and I think that's a good thing for those young people, it's a good thing for their parents, and it's a good thing for the city. Cafe TO also had a major push at the end of last week that has now ensured that we have more than 5,485 meters of new patio space to help restaurants and bars. Patios and cafes were installed in some major business improvement areas over the weekend, including Little Italy, Leslieville, Yonge and St. Clair, the Entertainment District, St. Lawrence Market, Corso Italia, St. Clair Gardens, and Queen West. The total number of restaurants benefiting from Cafe TO presently stands at 386 due to 213 curb lane closures, up from 148 curb lane enclosures on Friday, and that number is rising every day. Finally, I would like to let you know that I have today written to the Greater Toronto Apartment Association to urge them to have mandatory mask rules in the common areas of their rental residential buildings. Our city mask bylaw applies to public indoor spaces, like stores and malls, but does not apply to private residential properties. I know that many tenants want to make sure the common areas in their buildings are as safe as possible, and in that regard they have been communicating with me and asking me questions through the media about the putting in place of such a mask policy. I believe that implementing these rules in buildings will help residents protect each other from the spread of COVID-19, especially when you take into account the number of Torontonians who live in rental residential apartment buildings. It is an act of good corporate citizenship by landlords to have such a policy in place that would come at no cost and would make a significant additional contribution to the war on COVID-19. In the case of condominium buildings, such as the one that I live in, the condo corporations have in many cases, including my own building, implemented such policies and have simply posted city signage saying that people should wear a mask. People comply because they too are good citizens, because they want to protect the health of each other, and because we are all in this together. I am hopeful that the Association of Apartment Owners will strongly encourage its members to adopt a similar policy requiring face coverings in common areas such as the lobbies, the laundry rooms, and the elevators of residential rental buildings. While I suspect some buildings and some landlords may have already done so, many have not, and we know this because we continue to hear concerns from tenants. This would be one more example of how people and organizations across the city are working together to protect the health of our residents and to save lives. That's what it has taken to get to this point, and I'm confident that as long as this cooperation continues, we will be able to move fairly soon into stage 3 and beyond. And when that happens, it will be because the vast majority of Torontonians, all of you that are watching out there, have done and continue to do the right thing. And so once again, because I don't think I can say it too often, I want to thank you for listening to public health advice, for showing the patience that you have for months now. I think I heard somebody say this morning it was 19 weeks, and for understanding that we really are all in this together. I'd like to invite Dr. de Villa now to provide her update for this Monday.
Thank you, Mayor Tory, and good afternoon, everyone. Over the past 3 days, there were 107 new COVID-19 infections in Toronto. To date, 13,498 people have recovered, an increase of 121 since Friday. We are still seeing some fluctuations in our local case counts, but overall, our numbers are moving in the right direction. As Premier Ford shared earlier today, Toronto will join other parts of the province in stage 3 of reopening at a later date. While some may be disappointed with this news, if we move to stage 3 too quickly, we risk losing the progress that we worked so hard to achieve together. We need to move forward with caution and with care. We all need to try our very best to stop virus spread, and this means continuing to prepare for stage 3. As the Mayor indicated, we are seeking changes to be made to the province's stage 3 order that apply to Toronto. We made these requests because we are concerned with what we are seeing in other cities that have resumed indoor service in bars and restaurants. Cities who were a few weeks ahead of us in their outbreaks and have since reopened are now seeing increases in COVID-19 activity linked to reopening of restaurants and bars. In some cases, cities that had had very low or no COVID-19 activity are now seeing increases in cases linked to these settings. Fortunately for Toronto, we are able to learn from the real-time experience of other cities. My team and I continue to watch and learn from cities and countries that are ahead of us in reopening. And around the world, the evidence points to the importance of a slow and steady reopening. We must accept some risks with reopening, but the critical point is to make informed decisions that balance the risk with the potential benefits. We need to find the balance that helps our city to move forward in the safest way possible. The reality is, indoor public settings, such as bars and restaurants, present a higher level of risk because they involve the 3 C's of COVID-19 transmission: crowds, close contact, and enclosed spaces. It takes only one person with COVID-19 in this type of setting to potentially infect many others. This is why we are recommending seating and customer logs, mandatory masking, capacity limits, and staff screening. We asked for these amendments to ensure that we are doing everything we can to protect your health and for businesses to safely reopen in Toronto. The reality is that COVID-19 continues to circulate in our city. This means that we must all continue to wash our hands, keep our distance from others, wear our masks, and work together in the coming days and months as we continue to live with COVID-19. This includes keeping track of where you go in the community and who you're with. Should you be diagnosed with COVID-19, having this information handy will help my team to quickly identify your close contacts. It will help us work together to stop virus spread and to keep our city safe. As businesses reopen and as more people connect in our city, there will be increased COVID-19 activity. However, if everyone keeps doing their part, I am confident that we will be able to enter stage 3 as safely as possible. As we continue to move forward, please remember that our progress rests on all of us and the choices we make over the next several months. We all have to keep doing our part. On another topic, I want to take a moment to acknowledge that COVID-19 is not our only health crisis. I'm saddened to share that last week we experienced a significant spike in suspected opioid overdose-related deaths in our city. Tragically, there were 16 suspected opioid overdose deaths over 9 days between July the 8th and 17th, with most of these people under the age of 40. This is extremely difficult news to share. And on behalf of my team, I extend condolences to the families and friends of these individuals. Unfortunately, the ongoing opioid poisoning crisis has been further compounded by the COVID-19 pandemic, and these dual public health crises are having a significant impact on our community. We know that the unregulated drug supply is having a devastating impact on people who use drugs. Too often, there are unexpected drugs or contaminants in the drugs that people are consuming, and this is resulting in fatal and non-fatal overdoses. In addition, the public health measures needed to address the COVID-19 pandemic are requiring us to stay physically apart to help prevent virus spread. This can be isolating for some and can lead to people who would otherwise be very careful to use drugs alone, resulting in tragedy. My team continues to issue drug alerts to share timely information with our community, and we continue to promote harm reduction strategies as well. We are committed to addressing this very complex challenge. This is why we made several recommendations in May to the Board of Health to call on the federal and provincial governments to support the expansion of safer supply programs. These programs provide access to safe medications along with other supports and referrals to health and social services. The Board of Health supported these recommendations. We now look to our provincial and federal counterparts to respond to our recommendations. Finally, I am pleased to announce that our provincial colleagues are hosting another community pop-up testing site in the Black Creek area this Wednesday, July 22nd, and Friday, July 24th. The testing site will be at the Christian Center Church at 4545 Jane Street and will be open from 4 in the afternoon until 8 in the evening. I would like to extend my thanks once again to our colleagues at Ontario Health for this important initiative. In closing, we are all in this together. Whether it is the fight against COVID-19 or supporting our loved ones who are battling addiction, we all play an important role. So please, wash your hands, stay home if you're sick, wear your mask, and please continue to take care of each other. I'll now hand it over to Brad.
Thank you, Dr. de Villa. Before we go to questions, we have a number of staff on the line who can answer any detailed questions you may have, including Marianne Bedard from Shelter Support and Housing, Carlton Grant from Municipal Licensing and Standards, Suching Kakuta from Senior Services and Long-Term Care, Jeannie Romoff from Parks, Forestry and Recreation, and Jody Cowlin from Transportation. First question is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you. My first question is for Mayor Tory and Dr. de Villa. What benchmarks is Toronto not hitting in order for us to enter stage 3? Because if it's just a matter of collecting 4 weeks of data, that happens on Wednesday.
So I will take a first crack at that. Thank you for the question. Certainly having the time period in between moving from one stage to another is my understanding of what the province is looking at. That's certainly a big component of it. And you can appreciate why that's the case. You want to make sure, we want to make sure, that we have sufficient time as we move from one stage to the next, as it does take some time to see the impacts of the various stages. And in fact, in my remarks, I made some comments around what is happening in other jurisdictions. And it's interesting to note that some of which we're seeing, that which we're seeing in other jurisdictions, actually does take a number of weeks before you have the opportunity to have that manifested in the case counts and in hospitalizations and other of the monitoring indicators that we're following. But certainly, as I understand it, and I will remind you that this is in fact a provincial decision, yes, made in consultation with us, but it is their decision as it is their order that we're talking about. But suffice it to say that yes, we're looking at indicators, we're following the numbers. There is a time period that's required in order to ensure that the indicators truly are moving in the right direction and that they're continuing to stay there in order to progress safely to the next stage. I'm not sure if the Mayor has anything further to add to that.
Well, I just think it's important to note the movement from stage to stage was always contemplated as being in the 4-week range. It could have been shorter, but it was always contemplated in that regard. The regional approach was adopted partway into the reopening strategy, but I think it was a sensible one, and certainly one that I advocated for and supported, which brought into play the notion that there would be some regions that might be a little on a slightly different timetable than others based on their own adaptation and improvement with respect to the numbers. And finally, beyond the numbers and beyond the dashboard, which we publish each and every day based on provincial criteria so people can see whether everything's green or not, there are learnings that we have from other municipalities. I, for one, and I wholeheartedly support the decision of the medical officials provincially because it is their order and the Premier's ultimately accepting that recommendation because in the end, I see, and we all do, what's going on elsewhere, both in Canada and in particular in the United States, and I think we want to take as far down towards zero as possible the chance of that kind of thing happening where we would reopen businesses and then have to close them again. That would be way worse than taking a few extra days to make sure that we are in good shape.
Thank you. And my follow-up is also for Dr. de Villa and Mayor Tory. We just got an emailed, pardon me, we just got an emailed statement from the GTHA mayors and chairs, and it says the group is respectfully requesting the province carefully examine the rules and guidelines applicable to gyms and fitness clubs in order to make sure that these facilities are safe from a public health standpoint. So what's lacking in the current guidelines that you would like to see added for the reopening of gyms and fitness clubs?
Well, Dr. de Villa wasn't part of that discussion just around lunchtime today, but I was, and I can tell you this much, that they felt as a group that given the number of people who are going to be in gyms, notwithstanding some restrictions that are in place now as to how many at a time can be there, given the type of activity going on in there, which because of physical exertion has people breathing in a more intensive way, and because of the big number of touch points that exist inside these gyms, we were only asking, because of some concerns expressed by some mayors, that they take one more look to make absolutely sure that the disinfection, the regulations with respect to the numbers of people and so on, the spacing is adequate, because this was, they said, indicated, some of them did, that this has been found to be, and this may be where Dr. de Villa wants to comment, that gyms have been found to be a place like indoor dining and bars to be a place where it could be easy for the virus to be spread if proper precaution wasn't taken.
So if I can add just a little bit further to that, obviously I was not privy to that discussion, but I can certainly appreciate the concerns that have been raised or expressed as we've heard them by the mayors of the Greater Toronto and Hamilton area. And I think what it really speaks to is a couple of things. One, looking to the best available evidence that exists out there, looking to the experiences of other jurisdictions that are a little ahead of us with respect to their outbreaks and with reopening, and proceeding with appropriate caution and care. And if they're asking for a second look, a further look, just make sure that everything is okay, I think that's perfectly reasonable, and I think it's the appropriate thing to do, because we all want to be successful. We do not want to lose the progress that we've made together. We have worked very hard to get us to this stage as the City of Toronto, and I would dare say for the Greater Toronto and Hamilton area communities, we've all worked very hard to get to where we're at. We don't want to risk losing that progress, and if it means a little, an extra check and the exercise of extra caution and extra care, I think that's appropriate and reasonable on the part of the mayors.
Okay, thank you. We go next to Antonella Artuso from the Toronto Sun. Go ahead, Antonella.
Thank you. The Ontario Medical Association was quite clear. They said they did not want inside bars opening. Why have you recommended a compromise?
Well, I think it is in part the physical reality in the City of Toronto. And let's remember the letter that was written by me as the mayor based on advice received from Public Health at my request. And the reality in Toronto is we have 7,000 plus licensed premises, and that it's sometimes difficult to distinguish between a bar and a restaurant. They're often in the same one and the same place. And so we felt that the best way in which to try and address this from the standpoint of practicality in terms of actually having it be effective, and from the standpoint of making sure that we could try and let as many establishments get back as much into business as possible, but do so with the safest possible set of rules, was to put these additional safeguards in place. And so that is what I was quite comfortable recommending to the government on behalf of the City of Toronto only, and that would allow some of these people to get back to work, to get back into business, but to do it in a way that was even safer than the requirements that were proposed in Phase 3, and in fact, I guess are now in place in some other parts of the province that have moved to that stage.
Follow-up, Antonella?
Yes, thank you. But on another subject, there is a report that the city intends to remove the tents from Moss Park. I was wondering if you could talk about whether that is true and why you feel that's necessary.
Well, our policy has been consistent throughout, even before the pandemic, which is that we do not believe that encampments over a lengthy period of time are properly placed in public parks or other pieces of property like that. And that is for reasons of safety, which have been well explained before in terms of some of the fires and even deaths that we've seen, and from the standpoint of public health, and just from the standpoint of the use of that public land. And so we followed a very consistent, careful policy of giving people notice that the encampments cannot stay indefinitely, working very hard to find alternate housing for them. In fact, in the very same Moss Park last week, we found housing for, I think, around 160 people, and then removing the encampments. And that will continue to be the policy of the City of Toronto, because I think it is a balanced, sensitive, proper policy that makes sure people are treated sensitively who have housing-related issues, but at the same time that we continue to maintain the principle that encampments are not meant to be located in public parks or on Nathan Phillips Square or on other similar pieces of property. And that will continue to be the policy of the city going forward, and that will be the practice engaged in by city staff. And as for any particular plans that exist with regard to Moss Park, I should point out that the vast majority of the tents that were there are now gone, and there's a few people who are left, and we will continue to work with those people. But in the end, there can't be and shouldn't be a long-term encampment in a public park like that.
Okay, thank you. We go next to Jake Kavanch from the Canadian Press. Jake, go ahead, please.
Hi, my question is for Dr. de Villa and Mayor Tory. In terms of reopening, we've been in the low double-digit count in cases for the last few weeks. So I'm just wondering if there's a number threshold that would sort of trigger talks of perhaps rolling back some of the reopening plans, and if there's a number, what that would be.
So why don't I start with that? I don't think it comes down to a single indicator. As with everything, one has to look at the entire situation and to look at it in context. So you'll note that in our monitoring dashboard, there are 4 major categories of indicators that range from virus spread and containment, and that look at the lab capacity for testing, and look as well at healthcare and their capacity to manage patients and the very many medical issues that we have as a community, and as well public health capacity. So it's looking at the entirety, all the indicators and the context that we have in order to make the best decisions on a go-forward basis. Certainly, we're going to look at how much disease activity there is, how many tests are being done, how many come back, or what proportion are coming back as positive. But really, at the end of the day, what we are looking at overall is ensuring that we're meeting the objectives that we've had from the beginning, which include making sure that we're minimizing the loss of life to the extent that we can, to ensure that we're preserving healthcare capacity, and of course to mitigate all the social and economic impacts of COVID-19. These continue to be our objectives, and this is what we're monitoring or following our indicators for to ensure that we're on the right path.
I just say Dr. de Villa and her excellent team are our doctors for all the people in Ontario, in Toronto rather, including people who are in business. And if there's a day comes where she comes to me and says that the position being taken by the provincial officials who made this decision, or by the Premier for that matter, because he ultimately has the last say, are somehow unreasonable within the context of public health, which has to be our first consideration in Toronto, then that day, and not a day before, will be the day that I start to advocate strongly that we should reopen more quickly. But I think our objective, our shared objective between all of us, and I think there's been no daylight between the province, the city, and the medical officers of health, has been to reopen as quickly as possible, because we know people are struggling, but to reopen as safely as possible within the context of current health and future health. And I'm satisfied that we've been taking those things adequately into account every day when we talk about it. We talk about it every single day, not just on days when big decisions are afoot, and I think that's what we've been trying very hard to do. And I think it's why we've done well relative to most other places in the world in the context of our dealing with this, albeit that we've seen some tragedy.
And so my follow-up is a little bit different in looking ahead. In terms of going into the colder months, into the fall and the winter, many restaurants won't be able to maintain patio space, especially if they don't have outdoor heating. So how is the city planning on contending with many establishments needing to move their customers inside and having to weigh that against the profitability of their business?
So I think that's an excellent question, and certainly we're hoping that we will get to stage 3 before that, before the cold weather arrives. But again, in a very safe fashion, or as safe as can be, managing that balance that the mayor just spoke of. I think that there aren't simple answers to any of these questions, and I will remind our public out there, that there isn't a playbook for this. This is still very much a new virus, a virus that was discovered in January. And here we are in July with more knowledge, certainly. We have certainly learned quite a bit, but to think that we've learned everything that we need to know about this virus is simply not true. There is still much more that we need to learn, and we are trying to figure out the best path forward, the safest path forward for us in our context, recognizing that our situation is unique to us. We are certainly different from other parts of the province, and we have to keep in mind what our context is. So simply put, we will put forth the best available evidence. We will use the best available evidence, whether it's published in the scientific literature or it's observed in terms of the experiences of other jurisdictions, to make the best decisions that we can to support the objectives of our response. And yes, that absolutely includes managing and supporting businesses to be viable and supporting our economy to remain as strong as is possible, while at the same time ensuring that we're mitigating the negative impact of COVID-19.
Okay, we go next to Lauren Pelley from the CBC. Lauren, go ahead, please.
Question for Dr. de Villa. So we've been hearing that people in Toronto and probably elsewhere are getting tested in the hopes of having gatherings with family or friends and feel less at risk. So presumably gatherings where people are not distancing or wearing masks, basically getting tested so they can just go back to normal for, a cottage weekend or a barbecue or whatever it may be. What is your take on this approach from people, including the potential risks of this as well?
So thanks for the question, and it's certainly an interesting one, and I think it reflects the desire of many, many people in our community, and this is not exclusive to Toronto. But I do think that there is a strong desire on the part of many to try to revert back to as close to our pre-COVID life as is humanly possible. It's difficult to be isolated from our families and our friends. And so I do appreciate the desire to interact and to connect again, much as we have had the opportunity to do in the past. I will also say, though, that in our experience, and we've mentioned this many times, people have cooperated in large part. They really have been extremely cooperative. We wouldn't be where we are today if it weren't for the cooperation and the adherence of our population to public health advice and to the public health measures. So I would encourage people to continue on with that. With respect to people, undertaking testing as some method to try to allow themselves or to assure themselves that it's okay to get together, what I have to say is this. If you have symptoms of COVID-19, that's the time to get tested. And we have to recognize that a test is imperfect. It tells you about what your circumstances are at a particular period in time. So I would simply encourage people to please stick to the public health advice for now. We've made a lot of progress. We don't want to lose that progress. And I appreciate that people do want to connect, but the more we're able to stick to the public health advice, the more we're able to stick to our current public health measures, the sooner we will be able to get back to those regular activities or something at least closer to those regular activities in the future.
So when it comes to those situations where people are gathering, presumably these are people obviously outside of a 10-person bubble in many cases, because people wouldn't be wearing protective gear or distancing with people in their social circle. Would you say at this point, with where cases are, just to make it abundantly clear that outside your social circle, you should still be wearing a mask, keeping your distance, etc.? And would that change if, cases continually drop or spike? Like how could that advice change?
Well, I would say that first and foremost, the current advice holds, that we are asking people outside of your social circle, outside of that bubble, to please stick to the public health measures. Wash your hands, watch your distance, wear your mask. These continue to be the mainstays of prevention of COVID-19 transmission, and they will be part of our lives for the foreseeable future as I see it right now. What happens in the future? How will our guidance change? I don't have specific insight into that, and unfortunately, I wish I had the crystal ball that would tell us where we're going. I actually don't really have any special insight into that. But I can say that we will need to continue public health measures for quite some time because we will be living with COVID-19 in our community, and we know that washing our hands, wearing a mask, watching distance, and of course staying home when you're sick will continue to be important pieces of advice for us to follow as a community.
Okay, thank you. We'll go now to Mark McAllister from City News. Go ahead, Mark.
Thank you. A question for both Mayor Tory and Dr. de Villa. Mayor Tory, you had mentioned 7,000 establishments in the city, bars and restaurants. If it were a case of, say, 6,800 of those bars and restaurants are in fact responsible enough to make sure that everyone's following the rules, what do you tell those that are responsible, that might be upset by these additional measures you have asked for, when they have to hold off customers yet another week or two as a result?
I would say that I'm sorry that these kinds of additional measures are necessary, but I think we accept the fact that when we live in a society together where we look after the collective good, and oftentimes that means imposing measures or laws or regulations on a minority who, for whatever reason, don't want to go along, that is what we have to do for the collective overall good. And, you know, all it takes is one bar where one person goes in and carelessly fails to follow these rules, or where one business fails to try and keep them in place, and you could have, you know, these instances we've seen about super spreaders where people suddenly have infected 500 other people indirectly and directly, and those 500 infect 500 more. And I've come to learn about this as I've listened to the medical experts. And so I think it's just like every other law and every other measure we've had to undertake. I mean, it is unfortunately the case that most people, you know, do follow the law, but unfortunately some don't. And so you have to have rules that try and achieve the best possible result. And, you know, for me, all of these things would be temporary in the sense that as things continuously improved, you'd hope you could take some of them off. And that's the great thing about having flexibility in these rules and having the ability, as the province does, to vary these orders from time to time, and I hope they would.
And I'll ask that Dr. de Villa follow up on that, please.
Well, it's hard to add further to that. I think the mayor hit the nail on the head. There is evidence, I should say. We've seen this from other jurisdictions. We know that in respect of bars and restaurants, especially as they move to indoor service, that they give rise, right? They create the conditions that allow for COVID-19 transmission. Closed spaces, crowds, and close contact. And it takes very, very little. It takes one person with a COVID-19 infection who isn't even aware that they're sick. They may be pre-symptomatic or they may be asymptomatic. And we've seen those cases give rise to several other cases in the hundreds, as the mayor indicated. Hence, we're trying to provide the circumstances, to create the circumstances that actually allow for the best balance, right? Trying to protect our community against COVID-19 while at the same time ensuring that businesses and our economy can be as strong as possible under our current circumstances. I think this is it's a delicate balance. It's a difficult balance to achieve, but I think that what we've proposed thus far offers, you know, what I think is a reasonable reopening process, exercising appropriate caution and care.
Can I just add one more thing, Mark? I've spent quite a bit of time in the last 10 days as we were in stage 2, visiting with restaurateurs and people who are running the patios that are presently allowed to be open. And of course, most of them have indoor premises that they would like to reopen as part of stage 3. And while they have been very candid with me and telling me of the magnitude of their difficulties, and I understand that, and the need for some of the programs that are in place, rental assistance programs, wage subsidy programs, and so on, to continue, and for the need to us open up as quickly as possible, there isn't one who hasn't told me that it would be way worse for them to have some kind of a setback where we had to close everything down again. They all agree that would be the worst possible case scenario, and that is precisely what we're trying to avoid by being careful. Still having, you'll note these recommendations don't say close them down, as a previous question asked, and the OMA has recommended, but rather to say, okay, let's open them and let's do it carefully, knowing always you can relax these rules as you go forward if things are going well. But there isn't one person who doesn't think it would be the ultimate disaster to go back to a complete shutdown if that's what we ever had to do because there was a big spread of this virus.
Okay, thank you. We go now to Matt Bingley from Global News. Matt, go ahead.
Nope, none for me actually today. Mark just asked mine.
Okay, thank you, Matt. We'll go next then to Francine Copen from the Toronto Star. Francine, go ahead, please.
Good afternoon. So whether or not Toronto moves into stage 3 is a provincial decision, but these decisions are being made with, the assistance of regional public health authorities. Dr. de Villa, what is your understanding of why Toronto is being held back from stage 3?
Well, thanks for the question, Francine. I think when I've had discussions with my provincial counterparts, we've spoken about the time period between moving from one stage to the next. That certainly has figured prominently. And overall, it's a question of observing the trends for a sufficient period of time to ensure that what changes were made in moving from one stage to the next actually have had the chance to play themselves out. So that's my understanding. But as I mentioned earlier, of course, the final decision rests with our provincial counterparts, given that the order is one that emanated from the province. That being said, I think we all have the same goals in mind. You've heard the mayor mention this, and you'll certainly hear me say it again and again. We are all interested, I believe, here at the city and at the province as well, in ensuring that we're doing the best we can to balance out the risks and benefits of moving forward to the next stage of reopening. That will be our stance, and it will continue to be our stance, and particularly from the public health perspective. What I'm interested in is making sure that we're doing the best by the health of the residents of this city. That's always been our objective, along with, mitigating the loss of life, ensuring that healthcare capacity is maintained, and trying to minimize the social and economic impacts of COVID-19 and the broader health impacts as well. So we're keeping our eye on that ball. We're going to continue to do that, and we expect that we'll have a continued cooperation from our provincial counterparts on looking at exactly those same objectives.
And my second question, Ottawa Public Health has identified parties as a major source of new infections. Is that something that you're also seeing in Toronto? And if not, what is the most common source of transmission in Toronto? What is the data telling you?
So I don't have specific information with me today in respect of parties and what impact they may have had. I would imagine that any kind of gathering, particularly if it's in a, reflecting of the 3 C's that I've mentioned already, closed space, crowds, and close contact, those are the circumstances that certainly give rise to COVID-19 transmission. When we look at our data here in Toronto, we know that it's close contact with a case that is the major risk factor at this point of time. That most often occurs within the context of a household, but not exclusively. Meaning household contacts, people that you live with. So happy to look into our data to see if we're seeing similar trends as what's being seen in Ottawa, but certainly close contact with a case is the primary risk factor, and most often that happens in the context of a household, somebody that you live with.
Okay, thank you. We go next to Catherine Brulot from Radio Canada. Catherine, you there?
Bonjour, Monsieur le maire. Est-ce que vous m'entendez bien?
Oui.
Go. En français?
Oui, une petite question en français, si c'est possible. J'aimerais que vous nous expliquiez, Monsieur le maire, pourquoi les maires de la région de Toronto ont choisi de demander des mesures supplémentaires.
If I understood the question, I'll just say it in English properly, is that why do we think some extra measures need to be taken with respect to some of the things we talked about, gyms and bars and restaurants?
Particulièrement les bars, oui.
Nous pensons, les maires, qu'il il est nécessaire pour protéger la santé des citoyens et la situation COVID-19, d'améliorer les mesures présentement dans le stage 3 et c'est les autres mesures sensibles et pas avec un grand coût pour les entreprises.
Que dites-vous aux commerçants qui doivent attendre encore quelques semaines comme pour les encourager pour la suite des choses? Pensez-vous que cette attente va porter fruit, va leur permettre de faire des affaires de manière sécuritaire par la suite?
You'll have to repeat that. It's just a little bit tinny in it, and I have to concentrate very carefully. Can you just tell me in English the question, and I'll try and answer it in French?
Absolutely. What would you say to the business people that are hoping for the phase 3 to start in Toronto? What are you hoping for them when this starts? Do you think they will be able to keep going for a while to start this new way of making business, but to keep at it instead of maybe going back as some fear? And also, as Dr. de Villa said, we don't want to go back to a phase 2 eventually.
Je pense que si les opérateurs suivent les règles supplémentaires et les règles qui assistaient les gouvernements en améliorer la santé des citoyens, c'est possible pour les entreprises d'arrêter le COVID-19 et retourner à les règles comme normales. Si nous ne acceptons pas les règles supplémentaires et les règles très fortes, c'est possible pour toutes les entreprises d'avoir fermé complètement. Et c'est une situation inacceptable pour les entreprises, mais pour nous aussi, parce que nous voulons ouvrir l'économie maintenant.
Okay,
Thank you.
Merci. Final question is to Jennifer Pagliaro from the Toronto Star. Jennifer, go ahead, please.
Hey there. First, I just wanted to ask both of you, since sending the letter to the province about the additional measures for stage 3, is there any indication that they are happy to add that specifically for Toronto? And if they decide not to, can and will Toronto officials put those measures in place in addition to the rules from the province?
I can only tell you, we told them we were going to send the letter, and we sent it, and then we made it public as we told them we were going to do. And I had some conversations with some senior officials in the last day, and that they're taking very careful consideration of those measures. They've said that publicly, but they've also said it privately, which sometimes, there can be a difference, but they're looking at them very carefully. I asked for them only in respect of Toronto because I'm the mayor of Toronto. They were discussed with the other mayors today, the largest mayors in the region, and those mayors were interested in requirements of that kind because they too, I believe, and I don't want to put words in their mouth, but you saw what our statement said today, they too believe that this is a place where a lot of the hard work that we have done collectively as governments, but also as people and as businesses could be undone. And that therefore some of these very common sense kinds of suggestions which really don't impose, in most of the cases, an additional hardship of any substance on business. The notion that you would stay sitting down when you were in a restaurant or bar the entire time you were there, except when you were going to the washroom or arriving or leaving, is something that in a small way will contribute to a lack of crowd scenes and people standing up and talking at close quarters to one another, but it won't really or shouldn't really have any negative effect on the business. So these are the kinds of things that I think they're giving serious consideration to, and I thank them for that. And if they implement them only for Toronto, that's all I ask for.
I think if I was to add anything to that, I've certainly had some conversation with the public health officials at the provincial level, and they have demonstrated nothing but receptivity to hearing our thoughts and our advice on how best to proceed, as we're all interested in moving towards the next stages of reopening in as safe a manner as is possible.
One more thing. I hope people will understand out there, both the people that are in this business and the public who are obviously anxious to get back to going to their favorite watering holes and being able to have a good time. And that I hope they'll understand these decisions are being, or these recommendations are being put forward, and the decisions I think are being made in an utterly non-political way. They're being based on the words that I sent forward in terms of the suggestions were suggestions that came at my request, because I've been concerned about this for weeks, from the medical officer of health and her team. And I put them forward in exactly the way that they put them forward to me. And I also had conversations with the Government of Ontario that were utterly non-political, non-partisan, non-polarized discussions, simply focused on how we can advance public health in the best way possible and protect public health, and quite frankly, how we can avoid scenes of both bickering and polarization and division, and therefore a lack of complete focus on public health that we've seen from outside of our own country. And so I just hope people understand that it has been done entirely in that spirit, which I think is ultimately going to be for our long-term benefit, especially when it comes to both preserving health, but also trying as hard as we can to avoid scenes where you open things up and then have to close them again, which to me, will be a real disaster in terms of our ability to withstand that economically, let alone the health consequences.
And with apologies to Brad, because I actually kind of asked two questions in one there, and I theoretically have a third question, but I just wanted to try to clarify the second part, which is whether or not the city actually has powers, whether you, Dr. de Villa, or you, Mayor, under the emergency orders, could put in place some of the things that you've asked for in stage 3. For example, the one you mentioned about having people seated at all times in restaurants. Can the city do that on its own?
If I can do a 2-for-1 deal since you did, I will just say to you that in respect of, for example, the implementation of a mask policy in residential rental apartment buildings in the lobbies and laundry rooms and elevators, or some of the elements of what we wrote to the province about in bars and restaurants, it's possible we could, based on what the lawyers say to us, do some of these things, but the very fact that I'm saying it's possible we could reflects the kind of legal advice we're getting, which means that there's not a certainty we could do it. It's more effective, we've said all along on many of these things, including masks and including some of these other things, that it could be the subject of a provincial order, so it's consistent, and there's a certainty about the ability to impose these kinds of things. Look, I just shake my head in amazement at the very fact that on a public health matter like this, or on road tolls, or on photo radar, or a host of other things, we have to go and ask permission for these kinds of things in a city and a government of this complexity and the responsibilities that we all have to look after 3 million people. But that's the way it is, and so that's what we do.
Do you have a clarity? Or
Thank you.
final
Actually,
question?
you actually answered my third question there. I was going to ask you about making the apartment masks request mandatory. So we're on the same wavelength. Thank you.
Okay, thanks, Jennifer. That concludes today's briefing. Our next will be this Wednesday, the 22nd of July at 2 p.m. Thank you. What's that?